Hello, I'm Richard Diedrichson with the North Carolina Institute for Public Health at the University of North Carolina School of Public Health in Chapel Hill, North Carolina. We appreciate you taking time to join us for a few moments today. As a member of your own local Board of Health, you, more than most citizens, are aware of the important issues of board governance, general health topics, preparedness, and environmental health as they affect the citizens in your county. Today, we'll focus on environmental health. Let's begin by looking at the relationship of your local county environmental health personnel and local ordinances with the North Carolina Division of Environmental Health, where the bulk of the state's environmental statutes, programs, and personnel reside. The Division of Environmental Health is located in Raleigh within the North Carolina Department of Environment and Natural Resources, or DENR. The division director is a former local health director from Transylvania County, North Carolina, where he served for many years, but he began his public health career as a local county environmental health specialist. To outline some of the complex legal and financial relationships in environmental health between your county and the state, let me introduce you to the Division of Environmental Health Director, Mr. Terry Pierce.
The North Carolina Division of Environmental Health is a partner with local county health departments. The county provides the manpower and the state does the training and authorization. Local environmental health specialists are authorized agents of the state, and that delegation comes from the division. General statutes delegate authority, and that authority is passed from the Secretary of DENR through the Division of Environmental Health on down to the local folks. And that's where most of the work takes place. The financial burden is borne mainly by the locals. North Carolina general statutes require that environmental health specialists be college trained. They have to have a 4-year degree with at least 30 hours of biological or physical science. In addition to that, they have to go through the North Carolina Board of Sanitary Examiners, which also administer exams and oversee the credentialing process. In addition to delegating the authority, local environmental health specialists are also trained by the state through the division. There's a centralized intern training program, and in addition to that, there's various other training and that goes along with the authorization in the various programs. After these educational requirements have been met, the individual may apply for authorization in one or more of the following areas: food, lodging, and institutions, on-site wastewater and migrant housing, childhood lead poisoning prevention, child care centers, tattoo establishments, and public swimming pools. By using local staff, there's several advantages to that. The local staff are more in tune with the mores, the expectations in the community. That's not to say that we don't expect the rules to be enforced statewide, but it is an advantage to have local people carrying out these programs. I think a local Board of Health member needs to be as familiar with the programs as possible, support the activities, and also have an understanding that this is a regulatory activity and everyone will not be happy at all times.
Your county environmental health specialists have a complex relationship with the state based on intertwined programs, laws, ordinances, and even budget items. As a local Board of Health member, it is important to read, ask questions, and understand these responsibilities and even statutory requirements as you begin to examine environmental issues in your county. You have available to you knowledgeable, professional people to help you with environmental issues. These include your environmental health director or program specialist and your individual authorized local environmental health specialist. as well as your health director and your county attorney. Your local health director must merge county public health policies, procedures, and operations with those of North Carolina's.
The environmental health specialists at the local level serve as agents of the state in the enforcement of environmental health rules, regulations, and laws. So the provision of public health services actually take place at the local level. The primary role of the state is that of technical assistance, providing technical assistance to the environmental health specialist, also training and authorization. Certainly a lot has changed over the years in the area of environmental health. You know, it's an area that is constantly evolving. The state certainly does a good job, as does the UNC School of Public Health, in trying to meet the needs of our environmental health practitioners in the community. You know, they do go through a lengthy training process. There's also a registration process through the North Carolina State Board of Sanitary and Examiners, and so we end up with highly qualified practitioners out there in the field. Just being there and trying to learn as much about the jobs that are present in our local health departments. I've often heard staff comment how they would love for a Board of Health member or a county commissioner to just ride with them. You know, spend part of a day, go out in the field and see what they are involved in, engaged in on a day-to-day basis. Because it is a very tough job. They have to be have a lot of people skills in doing the job that they're called upon to do on a day-to-day basis.
Your local health director ensures that county public health policies, procedures, and operations protect your citizens while meshing smoothly and legally with North Carolina's requirements. Many of you have had the opportunity to attend the orientation training for boards of health. This training has outlined the rulemaking, policy guidelines, and procedural issues that you, as a Board of Health member, face. You are beginning to see the importance of your board in environmental matters as you help your county negotiate through the DENR rules, the North Carolina state statutes, and the local ordinances that protect your citizens and their environment. You will be asked to initiate local environmental ordinances and deal with environmental complaints and requests. To explain some of those unique environmental public health challenges, we've called on a multi-termed member of a local North Carolina Board of Health.
As a Board of Health member, we have in the statutes describing what we can do as a Board of Health member. And other than hiring the health director and making sure that that health director runs the agency, we also have the opportunity to make local rules. Then on the environmental health side, I don't think we as Board of Health members have to know all about food and lodging. We don't have to know about septic tanks, but we have to know that our environmental health specialist and the health director are well informed. The way that the Board of Health that I serve on functions is we have a period if any member of the community would like to come address the board or ask questions, they can do so. But certainly the board would not attempt to respond to a citizen without asking the expert in the field, what should we be saying, and we bring the Board of Health meeting. Certainly the health director is there and the environmental health director is there at every meeting to provide the technical background and expertise. If someone in the community is suddenly told their land doesn't perk and they've had their land in this family for 150 years and they want to cut a little piece off, they don't understand what perk means, and they don't understand why they can't just build a house wherever they like. Or if someone opens a restaurant, why do they have to follow any rules? So often citizens who are not sure, or owners of property or businesses, may come to the board with questions. As a local Board of Health, we have the ability to make local rules that would be more stringent than the state rules if there is evidence in the local community that there is a need to do this. certainly you wouldn't just suddenly react and say, I'm going to make a new rule, but we would ask the health director and the environmental health specialist and people from the state to provide information. Then we'd look at the issue and determine if we need at the local level to enact a policy, more than a policy actually, a rule that would go to the county commissioners and become the local ordinance in the given county. The Board of Health generally starts with their local attorney to say, here's what we can do or not do, and here's what we should be doing. And then the Institute of Government, or the School of Government at the University of North Carolina at Chapel Hill, has 2 attorneys that are experts in public health law, plus other attorneys, in fact, someone who is in environmental health law.
You have heard from Terry Pierce how your local Board of Health relates to the state environmental health rules, regulations, personnel, and policies. Glenn Martin has shown you how your role is key to aiding your health director in their role as the primary environmental health enabler and advocate for your county environmental concerns. And Rachel Stevens has shared the insight of a local Board of Health member and longtime advocate for environmental public health. Now we would like to introduce you to a sample of local environmental health specialists who are responsible for carrying out the day-to-day activities of your local and state-mandated environmental programs. Every North Carolina environmental health specialist has a science-based college degree, completed an intern training program, passed a national examination to become a registered sanitarian, and then completed specialty training to become authorized by the state to work in one or more of 7 disciplines within your county. In random order, let's begin with the program that you are personally in contact with each and every day, the Food and Lodging Sanitation Program.
Every single place that serves food to the public or provides a place for you to lay in a bed virtually is inspected by this program. That's every restaurant, that is every concession stand at ball fields, that's every kitchen at the nursing home where your parents are, that's every school cafeteria, that's every hotel and motel and bed and breakfast. All of those are inspected by the local public health department. Of course, we're regulatory in nature and we do the inspections, but we're also education in character also. It's as big a part, if not more so, than the regulatory portion of it. We're in there, we should be in there at a minimum of 4 times a year inspecting these various food service establishments. So the other 360 some odd days out of the year, we've got to rely on them doing what's right and knowing what's right to do. So that's where the education part's in. We're selling public health. We're selling public health every day that we're out there in these restaurants and other food service type facilities. The main thing that we need is resources. We need to be able to hire the staff that we need to run the program the way it needs to be run, number 1. Number 2, we need the salaries to be able to hire the best and the brightest and to be able to keep them in the county, where they're not leaving the county and going to work in private industry or leaving the county and going to another county in order to improve themselves. The other thing that we need, in my opinion, is legislative support to change the rules to allow for counties to charge a fee for this program. I fully believe that if we were fee funded, you could hire the people that you need to run the program and run it right. That's one thing that local boards of health could do to help any food and lodging program. We also need translation services. We are increasingly dealing with diverse populations. And I'm finding that that doesn't matter whether you are the smallest or the largest county. North Carolina's populations are becoming increasingly diverse. Clinics are mandated to have translators available. Environmental health programs are not necessarily. And on a day-to-day basis, we need the capability of accessing a translator so that we can begin with that process of public health.
Your environmental health specialists make a significant impact on your citizens' health every day as they inspect each of the county's food establishments as many as 4 times a year. Your specialists are teaching sanitation and good practice lessons to the owners each time they inspect, but inspections are a snapshot in time of an operation. You trust the owner will continue to use those lessons every day. By the way, your environmental health specialist will be your first line of defense in case of a foodborne disease outbreak in your county. More than 200 known diseases are transmitted through food. Many of the pathogens of greatest concern today were not even recognized as causes of foodborne illness just 20 years ago. This means that your environmental health specialist must continue to study and learn to keep abreast of foodborne issues that may drastically affect your county's citizens and businesses. National figures report that one outbreak of foodborne illness can cost a food service operation approximately $75,000 in legal fees, medical claims, employees' lost wages, discarded foods, bad publicity, and lost revenues. It is your environmental health specialist, perhaps together with a public health nurse and your health director, that form the basis of an EPI team that track all outbreaks in your county. Meet Mr. Robert Whitwam, Environmental Health Director and Registered Sanitarian in Forsyth County, where he also serves as a member of the EPI team.
Well, certainly an outbreak situation is a very tense situation in the community, typically very much publicized, very much concern in the community as well. The local health department will be involved in a very, very intense manner. Typically all the divisions within a local health department will be involved. And that board member, as a member of the community, will be looked at by members in that community for information, for some assurance certainly as to is everything being done in order to control this outbreak. It may be a foodborne illness outbreak, it may be an outbreak in a child daycare center, for example, that affects not only the children but the working moms and dads of those kids. Typically, when there is an outbreak, that's a very critical time in the community, and we want to put as many resources as necessary into identifying and controlling that outbreak so that we don't have spread and we can control the outbreak and affect as few people in the community as possible. So typically what we would do is start assigning people from routine work specifically to outbreak investigation and control. Now, in some cases, when that's a large outbreak, that will take the bulk of the environmental health staff to help perhaps interview or do site visits or collect data or enter data and try to analyze what's happening. Very often we spend a tremendous amount of manpower trying to track individuals that may have been in contact or may have been symptomatic individuals in contact with a case, trying to make sure they're not in a situation to infect someone else or further spread the disease. First, I would say understand, before the crisis ever happens, understand the mechanisms in the local health department. Understand that we're all working together with the same common goal to identify and control that outbreak. And it may mean that our routine services get slowed down somewhat, but it's our intent to satisfy the needs of the outbreak investigation, stop the outbreak as rapidly as we can, and then resume normal routine operations as rapidly as possible. If a board member has the understanding of our approach and how we work early on rather than 12 o'clock Sunday night when they get the phone call, I think it'll be much more appreciated both by the member of the public if they can explain what we're doing, perhaps just in general terms, but they need to have that basic knowledge of how we approach a crisis situation.
It is estimated that foodborne diseases cause approximately 76 million illnesses in the United States each year. By the way, your environmental health specialist will also be working with other outbreaks, including SARS, mad cow disease, rabies, and tick-borne diseases. Did you know that mosquito-borne diseases such as West Nile virus now appears in all counties of North Carolina? We're fortunate to have such continually well-trained specialists as one of our first lines of defense. Most of us have heard of septic systems, which are commonly septic tank soil treatment systems. These are effective methods for collecting, treating, and disposing of sewage from suburban or rural homes and even some businesses. But did you know that nearly 50% of North Carolina's homes use septic systems and that more than 40,000 new systems are being installed each and every year? Most all types of septic systems depend upon soils for treatment. There are over 400 soil types in North Carolina. A 1-acre lot may contain several different soil types, and soils may vary from lot to lot and house to house. Without proper soil testing, design, installation, and maintenance, even the largest building project may be doomed to failure. So it's easy to see that you'll be faced with issues of permit application, installation, and operations of on-site systems. Here to outline this crucial area is Andy Adams, registered sanitarian with the On-Site Wastewater Program.
Septic system is something that over 1 million people in North Carolina rely on for on-site wastewater disposal. If you don't live in town, you live out in the country, you're going to be using a septic tank system to get rid of your wastewater. The environmental health specialist in your county is responsible for the permitting of these systems. And as a Board of Health member, you'll be hearing a lot about the permitting and, more importantly, perhaps when a site does not get permitted. The environmental health specialist is going to be basically wearing 3 hats: that of a regulator, that of an educator, and that of a diplomat. As a regulator, they're responsible for, on a day-in, day-out basis, properly enforcing and interpreting a very technical and scientifically based set of rules. As a diplomat, they're going to be responsible for getting the message across to people in such a way that they often have to deliver bad news to folks. And they have to be able to make a point without making an enemy. And that's very important. The good, successful environmental health specialists are going to be doing that, or find a way to do that. And lastly, as an educator, they're going to have to combine a lot of very highly complex scientific areas: biology, geology, geography, soil science, economics, all of these, and boil this down into a language that the everyday person can understand. We don't actually use a perk test anymore. Probably haven't used a perk test in North Carolina in 25 years. That was the old way of pouring water in a hole. And of course, in the summertime, you can get just about any land to pass a perk test. However, in the wintertime, when the soil gets real wet, you're not going to have a system that's going to be working in a lot of cases. And therefore, we abandoned percolation test officially in 1982. We now use a method that is firmly grounded in soil science. We use basically the same soil identification techniques that the local soil conservation service uses. We take into account, you'll see us out there digging a hole, and a lot of people think we're magicians because we'll take a handful of soil and look at it a while and toss it on the ground and keep digging. But we're looking at very specific things. The soil is like a book, and if you know what to look for, that's what we train the environmental health specialists to do, is to look at things. You'll hear us talking about structure and texture and mineralogy and color and depth to rock or depth to water table. All of these things, again, as I said earlier, are things that have to be boiled down to a common language that folks can understand. And this is what the environmental health specialist is trained to look at and to do. Best thing that I can do, or I could recommend, is when you're coming on board, schedule a day to ride with them. And ask lots of questions. Take off your regular hat as to who you are. You may be a county commissioner, you may be a doctor, you've got your trained area of expertise, you're riding with a trained professional too. So take off your hat, ask open, honest questions of them, and also ask them what you can do. What do they need to do their job better? How can you be of help to them? Watch closely how they interact with people while you're riding with them, because the diplomat hat is probably the most important hat that they're going to wear to you as a Board of Health member, because oftentimes it's not the message that gets sent, it's how the message is sent.
Your environmental health specialists and soil scientists are the trained professionals you need to rely on to ensure that your systems are correctly sited, designed, installed, inspected, and maintained. Whether your Board of Health is facing a revision of on-site sewage rules, a need for a new wells ordinance, a review of existing permitting policies, or brand new environmental public health concerns, it is important for you to consult the expertise of your environmental health specialists as you approach these issues. The skills of these specialists are sharpened yearly by attending workforce development continuing professional education courses, such as those developed and held at sites across the state by the North Carolina Environmental Health State of Practice, or SOP, Committee, through the North Carolina Institute for Public Health. North Carolina's registered sanitarians believe completely in their roles and responsibilities, often with a great personal commitment to their community and their profession. The professional men and women you've met here today are typical of the 1,100 to 1,300 environmental health specialists working across North Carolina each and every day to ensure and protect the public's health, safety, and welfare. Until we meet again, thanks for joining us.